And we've also started to see data showing cost savings, revenue opportunities, patient satisfaction. We've got 94% of patients have a positive experience when they conduct a teledentistry exam. We've seen how many appointments can shift to virtual. So we have programs that have moved 7% of appointments to a virtual consult or a virtual follow-up. So you're starting to really free up chair time for procedures that are valuable to a practice, and patients love it because they don't have to take off work or shift their schedule to come in for an appointment that might not be needed. I'm Brant Herman, founder and CEO of MouthWatch. We have a teledentistry solution that we've implemented to really connect patients to care across all dental care touchpoints, and we're looking to expand it into more healthcare touchpoints.
Amazing.
So I come from a family of dentists, and we saw the impact that seeing the intraoral images in their mouth, how that a patient responds to that. So they start acting on care, they recognize the need and importance of oral health, and from there you have an opportunity to really connect them and educate them on the role of dentistry beyond just what a good-looking smile is or coming in for a cleaning. So we've been implementing teledentistry in practice groups, so everything from a small private practice to really a larger DSO, like 100 location practices where they're trying to communicate not only with their patients, but to their network of referring providers internally across their team, and just really bring digital and telehealth into part of what the dental patient experience is. So early there was some confusion around teledentistry and how does telehealth apply to dental care. I think as we've seen more practices and programs understand about communication and convenient connection to dental care, that's opened a lot of eyes, and we've also started to see data showing cost savings, revenue opportunities, patient satisfaction. We've got 94% of patients have a positive experience when they conduct a teledentistry exam. We've seen how many appointments can shift to virtual. So we have programs that have moved 7% of appointments to a virtual consult or a virtual follow-up. So you're starting to really free up chair time for procedures that are valuable to a practice, and patients love it because they don't have to take off work or shift their schedule to come in for an appointment that might not be needed.
What are some things that MouthWatch is working on right now?
So we're looking to take the lessons we've learned from implementing TeleDent into large practice groups and add a layer of a network of providers that can provide consultations and refer patients into a practice and really remove the lift and burden of implementing teledentistry on their own with their own current staffing. So we're going to provide kind of this layer of support for clinicians, for care coordination, to really bring teledentistry as a viable solution into any scale practice, into insurance carriers, and our long goal is connecting it into medical settings. Yeah, so we really want to connect every healthcare touch point to be a dental care touch point. So when a patient goes to see an oncologist or an endocrinologist or they have a transplant, there's a dental clearance that needs to happen, and right now that burden lives with the patient. They need to follow up with their own dentist and make sure they schedule an appointment. The dentist and the specialist aren't really communicating about that patient's care. So that's where we want to be the technology that bridges the lofty goal of medical dental integration. But as much as there's a desire to do that, we want to be the technology that makes that happen. So I think we're seeing practices that offer teledentistry find a path to communicate with patients before they have to travel to come into their office. So we've had one practice where their patient thought they had an emergency. They called the call center to schedule an appointment and have it triaged. They determined that they could set up a video consult with the doctor immediately. They spoke with the doctor. There was swelling and inflammation that required antibiotics before the patient came in. So this patient saved travel time for an appointment where they only would have gotten a prescription, and then when they did come in, they kind of had the right size and scale to what that appointment would look like and what they would need to do. So you save visits, you save travel time, better care for the patient, a better outcome. And then what's great is now that patient's able to have follow-ups take place virtually instead of having to travel 2 hours of their day just to get a follow-up appointment.